Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's discuss about one more very important E&M service, that is critical care. So we'll see what is critical care and what are the CPT ranges, and here we follow time-based coding, and also you should know the inclusive services of critical care and other guidelines that we have for critical care. Okay, and this particular service is very important for your CPC exam, so please do not skip this and please be thorough with this particular concept. Let's just get started with the PPT and we'll see the guidelines with a practice question. So first, let's understand the definition of critical care. Critical care involves the direct delivery of medical care by physician or other qualified health professional to critically ill or injured patient. Okay, so here the condition of the patient will be critically ill. Okay, and you can see the critically ill patient has a life-threatening impairments of one or the more vital organ system requiring high complexity decision making. So by seeing this high complexity decision making, don't think like we have to follow MDM guideline here. Okay, so they are just saying that the critical care conditions are very severe and it requires high complexity decision treatment. And coming to example, critical illnesses include central nervous system failure, circulatory failure, or septic shock, renal failure, hepatic failure, metabolic failure, or respiratory failure. Okay, so any organ dysfunction or multiple organ dysfunction will be there, or patient will be severely injured. Okay, they need a immediate critical care service, like that is an intensive care service. Okay, so that is what critical care means. We'll see codes and the coding guidelines in the further slides. Next, coming to coding guidelines for critical care service. Here we follow time-based coding. Okay, so remember, in the critical care service, we don't follow any MDM coding guideline. We only follow time-based coding guideline. So we have a code 99291. It is a primary code used to report first 30 to 74 minutes of critical care, and reporting only once per day regardless of number of separate critical care sessions. So one calendar date, in the particular calendar date, if physician is performing at 10 o'clock, okay, 10 a.m., maybe 1 hour critical hour or a critical care provider has provided, and maybe in the afternoon 1 o'clock, 1 more hour they are providing the critical care service. Okay, in this case, what we do, we will add this together. Okay, both the session timing we will add and we will code only one code. Okay, we don't have to code for separate code when it is in a same encounter. And then we have an add-on code 99292. So used to report each additional 30 minutes beyond the initial 74 minutes. Refer the following time chart for an appropriate code selection. So here when we meet additional 30 minutes, okay, we will take the add-on code 99292. So while taking an add-on code, you might get confusion. So please refer the chart. And if you see here, less than 30 minutes, if the physician is performing critical care less than 30 minutes, then that is not eligible to code critical care service. Okay, we will go with the appropriate E&M code. Say for example, patient is admitted in the hospital and getting a critical care, but physician has performed critical care for 20 minutes. So in this case, you don't have to code for critical care service. Instead, you will code hospital initial services code. Okay, so less than 30 minutes, remember, we will not code critical care. It should meet more than 30 minutes. So followed by, we have a timing criteria, you can see here. And as I said, to avoid confusions, if you are getting a scenario in the CPC exam, or if you are practicing for CPC, better whenever you are dealing with the critical care scenarios, you refer the table that we have in the CPT book. Okay, so same chart is there in the CPT book, so that to avoid confusion, just see in which range that time you are getting. Say for example, you are getting 100 minutes. Okay, 100 minutes you are getting in 105 minutes to 134 minutes. Okay, so in that you can just choose this 99291 with 99292 with units 2. Okay, so you will not have any confusion. And if you see here they have given with the minutes. Okay, and in the exam they might give in the hours. Okay, 1 hour, 2 hours. Okay, so that 60 minutes, 120 minutes. Likewise, you should check and you can select the code according to that. Okay, so these are the codes that we have for critical care. Remember, only two codes, one is primary code and one is add-on code. So documenting time for critical care. So we know that we will code critical care based on time coding guideline, right? So documenting time is very important here. So the documentation. Time includes all the activities directly related to care of the critically ill patient, such as reviewing patient records, interpreting the lab result, discussing the case with the family or a surrogate decision maker if the patient is unable to participate. Okay, and these are the directly whatever the physician will render the service towards the critically ill patient will always contribute towards the total timing. But non-qualifying activities such as routine updates unrelated to critical care or administrative tasks should not be included. And time does not need to be continuous but must occur in the same calendar date. So previous slide I already given you an example, like the provider has given critical care service at 10 o'clock 1 hour and at 1 o'clock 1 hour. Okay, so these services are not continuous. Patient in middle, patient might be taking rest or patient is on IV, whatever it may be. So 1 hour 10 to 11 1 hour critical care they have performed, and 1 o'clock to 2 o'clock 1 hour critical care they have performed. So while coding a final code, what you have to do, you will add the hours. Okay, here 1 hour, here 1 hour. So you will code total 2 hours critical care service. Okay, so that is the guideline says time does not need to be a continuous but must occur on the same calendar date. Okay, on that particular date, how many different multiple encounters that physician has given critical care services we have to see, and we can add the total hours and we will code particular single critical care code, and if add-on code is required we will utilize the add-on code. And next, if critical care to the transport services. So general critical care we will be using 99291 and 292, and for critical care services provided during the patient transport, example between facilities. Okay, so even if it is between the facilities, if the provider is giving critical care to the patient, you don't have to check the unit, you will go with the critical care services only when you meet the timing criteria. Okay, and next, for pediatric transport, patient 24 months or younger, report 99466 to 99467. So this is for pediatric. So we have a pediatric ENM guidelines also, we will see that later part. So next coding guideline we have regarding patient location. Critical care can occur in various settings including ICU, coronary care unit, emergency department, or during patient transport. Okay, and location does not solely determine critical care. The patient's condition and the critical care provided are the key factors. So this is what you remember here. Here critical care services are not based on any location. Okay, this service critical care is not any unit. Critical care is a service, okay, where the provider can perform to the critically ill patient or critically injured patient. The physician can perform critical care service in ED, or he can also perform in ICU. What you have to check, you don't have to check the location. You just have to check what is the patient condition, whether this patient is critically ill or injured, and what kind of care is given to the patient. Okay, from provider end, if critical care is given, we will check the timing criteria. If it is more than 30 minutes, we will bill critical care though the patient is in ICU or the patient is in emergency department. Okay, so this is the guideline we have regarding patient location. Next guideline we have is multiple patients and providers. So when critical care time is specific to the individual patient and provider. So what they are trying to say here is, as we know, we are coding based on time. So while calculating the total time, we have to check whether this total time is regarding an individual patient and provider. Okay, so this individual provider should specify his time to individual patient. Okay, so when in middle, if the provider is going and seeing some other patient, okay, if he is spending some half an hour to the other patient, then you cannot consider that additional half an hour. Okay, it is for other patient. So whenever we are calculating total time, it should be individual patient and the provider. And a physician cannot report critical care for a multiple patients during the same time period. So this is also important. As he is performing critical care, he also should be very responsible. Okay, if he start critical care service to the one patient and same time he should not go and see another patient. Okay, so that is what they are saying. Physician cannot report a critical care for multiple patients during the same time period. He should give his attention, he should give his total time to the particular patient once he start the critical care service. And next guideline we have regarding neonatal and pediatric critical care. So here specific codes apply for neonatal and pediatric. So we have NICU codes. Okay, NICU codes are based on age. The first criteria is age, and next thing we will check whether it is an initial visit or a subsequent visit, and also based on age and this particular initial or subsequent, we will have the codes. Okay, neonates are the like 28 days, and pediatrics we have certain codes. You can see 99468 to 472, 475, 476. So based on age, we will select the NICU codes. That is also one more specialty. We will discuss that in a later sessions. So next, very important coding guideline we have with the critical care service is bundled service. Okay, since you know the critical care service is a major service, with these critical services, there are many other services can be performed. Okay, so you have to be aware about inclusive services along with the critical care. So if you see, the following procedure when performed during critical care are bundled and not reported separately. So if you are billing 99291, okay, critical care service, in the same scenario, if you get chest x-ray, okay, you should not bill for chest x-ray. You can bill only ENM, that is enough. Why? Because your chest x-ray, cardiac output measurement, pulse oximetry, blood gases, gastric intubation, ventilatory management, all of these services are already included with the critical care service, and you should not bill them separately. Okay, so go through this, and in the CPT book also you can see that inclusive services, and whenever you are dealing with a question, and if you have any kind of procedure, just make sure that particular procedure is there in your inclusive service or not. And if it is not listed, okay, you can report it separately. So this is important. Please be thorough with this guideline. So next we'll see one quick practice question. So here a 58-year-old male present to the emergency department with a severe shortness of breath, chest pain and low blood pressure. The patient is tachycardic and hypoxic, suspected to have a septic shock. Physician spends 80 minutes providing critical care. So we need time here. So physician spend 80 minutes. Okay, and with that you can see other procedure they have performed, like chest x-ray they have performed, and ventilation, intubation. So there are other services also they have performed. So as you know, if once you have other procedure, you have to check that other services are included or not. So if you see, chest x-ray is included, ventilation management is included, and intubation is also included with the critical care. Okay, so let's focus on the critical care question. CPT code here for 80 minutes. You can see options 9929 only, 291 and 292, 291. Okay, with the units, they have just given a different units. So for 80 minutes, if you see this, where we are getting 80 minutes in between 75 to 104 minute. Okay, here we will be getting 80 minutes. So our answer will be 99291, 99292 into 1 unit. So answer is B. Okay, 291 and 292 with the unit 1. Okay, if the physician has given around 110 minutes, okay, critical care service is for 110 minutes, then what would be the answer? 110 minutes we will get here. So we would have selected unit 2. Okay, likewise, in the critical care service, the first thing that you have to check is timing criteria. Okay, you should get more than 30 minutes. More than 30 minutes only eligible for critical care. If it is less than 30 minutes, code appropriate E&M code. That means wherever the patient is seen, that particular code we have to code. Okay, not a critical care code. And the next thing what you have to see is inclusive service. So if you have any other procedure, please refer the inclusive services, and if the particular procedure what physician has performed, if it is already listed in inclusive service, you don't have to code it. If it is not listed in inclusive service, you can code that particular procedure separately. Okay, so these are the coding guidelines we have for critical care, and that's all, guys. So I hope you are understanding, and everyday basis I'm trying to cover one topic. So we'll see how much I can able to cover. I'll try to cover. And if you find this video helpful or useful for you, please do subscribe to my channel, and please do share with your medical coding friends. And also many of you are asking when I'll start my CPC preparation classes. So I'll be starting in Jan 15, maybe Jan 15. I'll post it. Okay, based on that you can reach me out. And currently the basic to advanced classes are going on, so I am busy with that. And also my regular work is there. So I'll plan and I'll let you all know. And yes, thank you all. Thank you for watching.